Welcome. In this session, we're going to speak about cancer and diabetes. By the time you end this session, you should be able to speak comfortably about the burden of cancer and diabetes, the risk factors for these diseases, who is most affected by them, their health and economic consequences, and what can be done to address them. Let's begin with two vignettes. Boris is a 50-year-old man in Moscow, Russia. Boris has been smoking tobacco since he was 17 years old. Over the last several months, Boris has developed a terrible cough that he can't get rid of. Boris's doctor recently told him that he has lung cancer. Renuka is a 45-year-old woman in Mumbai, India. Over the years, Renuka has strayed farther and farther from her traditional diet. Renuka, despite her age, now has diabetes. She also suffers from high blood pressure. In low and middle-income countries, people often get non-communicable diseases like Renuka at earlier ages and die of them at higher rates than in high-income countries. So let's talk with these vignettes in mind about cancer and its burden of disease. Cancer is unique because it comes in many forms, and each form may have different risk factors for different people. In 2010, cancer made up about 15% of all deaths worldwide, and all forms of cancer, when taken together, cause more deaths than any other individual cause of death. In 2010, all forms of cancer together constituted about 8% of DALYs. All forms of cancer together produced more DALYs, or were associated with more DALYs in that year than any other individual cause of DALYs. Now, the International Cancer Database, called GloboCan, estimated that there were 14.1 million cancer cases and 8.2 million cancer-related deaths in 2012. So let's look at a graphic that shows us the leading causes of cancer for the world, for low and middle-income countries, and for high-income countries in 2012 by the number of cases. And what we've done here is color code the types of cancer so that you might distinguish them more easily. There are a number of takeaway messages here, but what we see of special importance is the really special significance and the extent to which lung cancer and the related cancers that we'll talk about are so important globally, and also so important in both more developed and less developed regions. We also see that there are a number of cancers that are of great importance globally and in both high income and lower income countries that actually relate to infectious causes like liver cancer and cervical cancer, as we mentioned. And we'll also see here, but much more significantly in more developed regions and less developed regions, how prostate cancer becomes an important cause of death as well. Now, in the next graphic, we're going to see how the types of cancers vary by World Bank region and for the high-income countries. And this is cancer deaths by region for 2010, also color-coded. And this gives us a little bit different view from the last slide, a more disaggregated view, but also highlights across the regions and for high-income countries the exceptional importance as a cause of death of tracheal, bronchus, and lung cancers. When we look this way, we see that. When we look this way and we look at among the lowest income countries in sub-Saharan Africa, here, as we would expect, even though it's not something that makes us particularly happy, what we see is the two leading causes of cancer deaths are both cancers associated with infectious causes. And we also see, as we look across the graphic, and we see, by the way, of course, this is very predominant here, but it's also true that liver cancer, often related to hepatitis B, is a very important cause of death in a number of places. And cervical cancer is also very important in the next least well-off region in income terms. So this is also a graphic I encourage you to look at further, but these are some of the most important takeaway messages from this graphic. Now, many of you will be familiar generally with the risk factors for cancers, but let's look at in the next graphic at the leading risk factors for certain types of cancers. Remembering what we said at the beginning, which is there are many different forms of cancers affecting many different people, and they have often different risk factors. And here what we see is a number of the most important forms of cancer types and the risk factors, leading risk factors associated with those types. We do see that there is one risk factor that cuts across several of these, and that's alcohol. But in addition to that, we see, for example, in liver cancer and in cervical cancer, these infectious causes, human papillomavirus for cervical cancer and hepatitis, two forms of hepatitis, plus schistosomiasis, which is a parasitic disease, they're associated with liver cancers. And we also see the importance, for example, of obesity. So again, many of you will be familiar with some of the basic issues concerning risk factors for cancers, but it's very, very important to think carefully about what types of cancers are most important in what settings, what are the risk factors for them, and how is it that they might be addressed. Cancer exacts a very high cost on individuals, on households, and on society as a whole. First, there's no question individuals and their families face high direct costs of care when a family member is stricken with cancer. Second, individuals, of course, if they're sick, often can't work and face important economic losses as a result of that. Third, treatment is mostly available in urban areas and better off regions, especially in low and middle income countries, and therefore the poor and more marginalized people who get cancer are much less likely to be able to get diagnosed or treated than better off people and more urban people are able to do. And in addition, there are higher death rates among less well-off people for these reasons than there are among people who are better off. So it's quite clear that cancer prevention and control can reduce ill health, lessen lost productivity, and help to prevent what are catastrophic costs faced by many individuals and their family as well. Now, a number of cost-effective measures can be taken to try to prevent cancer and cancer deaths in low and middle-income countries. These are outlined here, and they're taken from the cancer volume of the third edition of the Disease Control Priorities Project. And that's a set of documents and an important study that I recommend to all of you that looks not only at cancer, but at a wide range of global health issues. On cancer, what the DCP3 panel has recommended is a proposed intervention package that can address cancers, especially in low and middle income countries, in cost-effective ways. Some might concern policies and regulation. Some can be carried out at the primary health care level, some at the hospital level, and some requiring more specialized units. And it's important when we think about interventions and an intervention package, indeed, to think about the platform from which these interventions are going to be offered. And here was what they suggest is, one is, there's a real need in these settings for greater education about cancers, how they manifest themselves, how you might know whether or not you have cancer, and how, in fact, they might be diagnosed, prevented, diagnosed, or treated. And then in addition, tobacco control, as you know, is such an important risk factor for cancers that it plays a prominent place in this package, and there are a well-known set of cost-effective activities that can be taken to reduce tobacco consumption, including taxation, banning smoking in certain places, restricting sales to minors, and trying to enable people to stop smoking who are smoking now. It's also suggested that in prevention, that one focus on the cancers that can be prevented through immunization, such as the HPV vaccination and the vaccine for hepatitis B. They also suggest that a number of cancers can be treated in cost-effective ways, provided they can be diagnosed at their earlier stages, as noted here as well. Now, however, when you're thinking about low-resource settings, it's quite clear that many of them do not have the capacity or much capacity to treat. And therefore, as countries move toward wanting to treat more cancers, it's going to be important for a number of them, especially the low-resource countries, to develop radiation facilities, to develop better lab and pathology facilities for cancer, to promote surgical treatment for breast, cervical, and colorectal cancers, as well as to enhance their ability to provide palliative care. Let's move on now and talk about diabetes.